name's Melody. I'm a nurse practitioner student with Northern University. So I'm going to be here to assess you. I'm going to go ahead and wash my hands. So can you tell me your first and last name?
John Smith.
All right, and your date of birth?
12/26/91.
All right, what year is it right now?
2019.
And who is the president?
Donald Trump.
And why are you here today?
Routine checkup.
Okay. So from that I can tell that he's alert and oriented. Skin looks appropriate from here. And his ABCs are also intact because he is able to talk to me. So before I came in today, they did get your weight and your height. So you are 5'9" and 220 pounds, which makes your BMI 33. They also got your vital signs. Respiratory rate was 18, temperature was 97.9. Blood pressure was 128/70, and your heart rate was 79. So we're going to go ahead and we're going to assess your vision really quick. So can you cover your right eye and tell me the lowest sign that you can read?
PDTNUHC.
Okay, now cover your other eye.
PDTNUHC.
All right, and I cover both eyes and read that for me.
PDTNUHC.
Okay. All right, so I'm gonna go ahead and I'm going to assess your scalp. So I'm gonna make sure there's no lumps, bumps, and then I'm also gonna look for any lesions or infestations. So all that looks good. No problems there. And now I'm gonna go ahead and check for facial symmetry. So can you close your eyes really tight for me? All right, open them. All right, smile for me and frown. Okay, so that's there's symmetry within his face. I'm gonna go ahead and palpate your sinuses. Okay, any pain there?
No.
Right there.
No.
Okay, so no problem with his sinuses. Now I'm gonna go ahead and palpate your jaw here and check for the crepitus. Open your mouth, close your mouth. All right, no crepitus, so there's no signs of TMJ. I'm gonna go ahead and assess his pupils. So I want you to look right here. Follow it without turning your head. Okay, now I'm going to turn this light over to your eyes. Just look ahead. Okay, so they're equal, reactive and accommodating to light. So, do you have any problems with your eyes or anything?
No.
Okay, I'm going to go ahead and assess the sclera and the conjunctiva. So, the sclera is white and not bloodshot, and the conjunctiva is pink and moist. I'm going to check with the otoscope and check the optic disc. All right. Optic disc is round, no signs of palpable or hemorrhage on either side. So we're going to go ahead and move on to your ears. I'm going to palpate. If you have any pain.
No.
Okay, turn your head. I'm going to assess for any excessive earwax. I'm going to go ahead and look into your ears. Okay. Tympanic membrane is not red. So all that checks out. Tympanic membrane is pearly. There's no problems with your ears, right? Okay, so I'm gonna go ahead and I'm gonna whisper words into your ear, and I just want you to repeat it back to me. Red can.
Red can.
White House.
White House.
Okay. So no problems there. So we're gonna go ahead and I'm gonna just assess your nose really quickly. So it is midline in the face. There's no deviation to the right or left. Can you tilt your head back? There's no deviation in the middle. So I want you to cover one side of your nose. Take a big deep breath through your nose. Okay, do so on the other side. They're patent on both sides. Both nostrils are patent. So I'm gonna have you open your mouth. I'm gonna assess your teeth. I don't see any broken teeth or obvious cavities. Or buccal mucosa is pink, and gums are pink and moist as well. Say ah.
Ah.
All right. You feel in the soft palate of the mouth both move with that. So cranial nerve number 9 and 10 are both within normal limits. Can you stick your tongue out for me? Okay. Cranial nerve number 12 is also within normal limits. I'm going to assess his neck. Can the salivary glands I'm able to palpate those. Can you swallow for me? Okay, thyroid moves whenever I ask him to swallow, so that's within normal limits. Now I'm also going to have you turn your head against my hand. Turn your head against my hand. Okay, now shrug your shoulders. Okay. Cranial nerve number 11 is within normal limits because he's able to do those things. So I'm going to test you, I'm going to fill up your lymph nodes, preauricular, postauricular, submental, submandibular, jugular-digastric, your superficial cervical, your deep cervical, posterior cervical, occipital, and your supraclavicular. So shrug for me. I'm not able to palpate any of those, so that's all within normal limits. Now I'm going to go ahead and palpate your carotid artery. Make sure the rate, rhythm, and strength is within normal limits. Okay. I'm also going to listen for a bruit on either side. Turn your head. Alright, so rate, rhythm, force are all the same. I did not hear any bruit. Now I'm going to assess your upper extremity, so can you hold your arms out for me for 10 seconds? 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay, can you put your arms down? Turn your arms out like this for me. So they're both warm, he's not diaphoretic or anything like that. Can you squeeze my hands? Okay, now put your arms up like this. Pull back, push forward. All right, I'm also going to assess your fingernails. So just hold your fingers out like this. No clubbing or spooning. The capillary refill is fine within less than 2 seconds. No problems with the nails. Strength is equal on both sides. Don't see any ulcers on either or bruising on either of his upper extremities. So that's all within normal limits. Now we're going to assess your respiratory status. So just standing here, I don't see him to be in any distress. He's not using any of his accessory muscles. And he seems to be unlabored. Don't see any type of cyanosis. So I'm going to go ahead and listen. Can you breathe through your mouth for me? Big deep breath. Okay, I'm going to go to the back. Underarm up here. This side. Okay, so I can hear bronchial breath sounds through the upper lobes, bronchial vesicular throughout the middle, and then vesicular breath sounds throughout the periphery. I didn't hear any wheezing or it just sounded clear throughout. So I'm going to assess the axillary lymph nodes. So I'm going to look right here at the lateral lymph nodes, the pectoral lymph nodes, central, and subscapular. Okay, now no problems on the left. I'm going to palpate the lateral, pectoral, central, and subscapular. So I'm not able to palpate any of those, so that's all good as well. Now I'm going to assess the breasts. So they look to be symmetrical. Can you put your arms above your head for me? I don't see any dimpling or any obvious lumps there. Now when you put your hands on your hips and just flex your pecs, okay. No problems there, let's still look equal. No lumps that are protruding. No pain or anything like that, correct? Okay, so I'm going to have you go ahead and lay down. I'm just going to palpate light, deep, and medium throughout the breast to make sure there is no lumps. I'm not able to palpate any lumps on the right. Okay. I'm not able to palpate any lumps on the left either. Now we're going to go ahead and I'm going to listen to his heart, and I'm also going to check for any jugular venous distension. Okay, so from standing right here, I can't see any jugular venous distension. I'm going to auscultate his heart. Aortic. Pulmonic. Tricuspid. And mitral. Now I'm going to listen with the bell for any murmurs. Alright, so I wasn't able to hear any extra heart tones or anything like that. I was just able to hear S1 and S2. So that means that so far everything with his heart is within normal limits. No JVD. Now we're going to move down to his abdomen. I'm first going to auscultate his abdomen and his renal arteries and aorta. Alright, so I wasn't able to hear any vasculature sound or any vascular sounds in the what I was listening for the aorta or the renal arteries. I was able to hear bell sounds in all four quadrants. And I'm going to palpate your abdomen. Tell me if you have any pain.
No pain.
I wasn't able to palpate any type of mass or any type of abnormality within when I did the palpation. The skin all is dry and warm, so no problems with the abdomen. So now we're going to look at his lower extremities. You can go ahead and sit up. So his lower extremities are warm. Not diaphoretic or anything like that. I'm going to look at his legs and palpate and see if there are any varicose veins. Okay, I'm also going to palpate the pedal pulses and check capillary refill in both feet. Alright, so pedal pulses are normal on both sides, just +2. I'm not able to find any varicose veins in either of his legs. And then the capillary refill is less than 2 seconds. The rate on each of his pedal pulses were the rate, rhythm, and strength for both normal on both sides. So I'm going to check your strength on each of your legs. Can you pull back, push forward? So that's within normal limits. Can you lift your knees up towards your chest? You abduct, lift your hips out. Okay. And just lift your legs up. Hold them for 1, 2, 3, 4, and 5. Alright, so that's all good. He doesn't have any problems with any of the range of motion. So now I'm going to check for the Binsky in both of his feet. I'm going to hold your leg up here. Okay. Okay. But his toes curl both sides. So now I'm going to check the reflexes in his upper extremities and his lower extremities. So I can see both of his fingers move on both sides. Now I'm going to check the tiller. Okay, so his feet move with both of those. So he has positive reflexes on both sides. Now I want you to go ahead and stand up. Okay. Now I want you to turn around and walk towards the door, heel to toe. Okay, and walk back. Okay, now I want you to close your eyes and stand still. We're checking for any type of swaying or anything, doing the Romberg test. Okay, you can open your eyes. Now I want you to look at me and put your nose or your finger to your nose and then to my finger. Okay, other side. Okay, you can go ahead and sit down. Actually, turn around and I'll assess your back. So, shoulders are both equal. Scapula appears to be equal bilaterally. And can you bend over? Okay, so spine appears to be midline, no bulges or anything like that throughout the spine. All right, so you can go ahead and sit down. So I want you to take, we tested for ataxia for the upper extremities, now we're going to test for the lower. Can you put your shin or your heel to your shin and move up and down? Okay, other side. So no ataxia in the lower extremities either. Now we're going to test for sensation. I want you to close your eyes and tell me when you can feel me touching you with this cotton ball.
No. 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 No.
Okay, so you can feel me touching all the extremities. Now I'm going to test your light and dull, or your dull and sharp sensation. So I want you to close your eyes and tell me if it feels sharp or dull.
Sharp. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp.
Okay. So able to differentiate between sharp and dull touch. All that is with the normal limit. So one last thing, I want you to stand up for me and just turn side to side, and we're gonna make sure there's no pain in your back.
No.
Okay, all right, so that concludes the physical assessment. So any questions? All right, that's all.